Hi, this is Dr. Camann again, and I'm the Director of Obstetric Anesthesia at Brigham and Women's Hospital in Boston. And we're here at IsisParenting in Needham, Massachusetts, and I'm with Amanda, who is going to deliver in a few weeks. And she has some questions about epidural anesthesia. So we're going to discuss a few questions.
I've been wondering, what does an epidural feel like?
Well, what an epidural is medication which is administered to the nerves around the lower portion of the body through a little catheter inserted in the lower part of the back. So what happens is, if you can imagine how you might feel when an arm or a leg goes to sleep, you kind of feel very numb. And this will happen from roughly around the area of the belly button on downwards. So that area will feel numb. You still, in most cases, will be able to feel some of the contractions or be aware that you're having a contraction, but it might feel like a little bit of a tightening or an ache and not the kind of severe pain that you were having before the epidural was administered.
My mom had an epidural years ago and she said it was awful, and I'm just wondering, how has the process changed over the years?
Well, this is a very good question because it has changed quite a bit. The main way that it's changed is that the dose of the medication that's administered has been dramatically decreased. And the reason is that we now use a combination of several different medications, and using the combination allows us to decrease the dose of each one of those. By decreasing the dose, we can reduce the incidence of some of the side effects. The most common side effect is that epidurals that were administered years ago, say even 20, 30 years ago, had much higher doses of the type of medication that blocks the ability to move. So many people that had epidurals years ago will say that they almost felt like they were paralyzed. Their legs could not move at all. They couldn't even turn from side to side in the bed. Whereas now the medications are used in a much lower dose and different types of medications, which will allow the pain to be taken care of while still retaining the ability to move the legs. So in many cases, patients can move from side to side in bed, they can sit up in bed, they can have some degree of control over the pushing stage to help with the pushing out of the baby. In some cases, you might have heard the term walking epidural. It's a little bit of a misnomer in that there's actually very few hospitals that allow patients to actually get up and walk around. But the walking epidural is still appropriate in the sense that patients would have enough ability to move the legs that in many cases they would be able to get up and walk, even though they do have to stay in bed.
I see. I've heard this term patient-controlled epidural anesthesia. What does that mean?
Yes, well, patient-controlled is the way most of the epidurals are administered at most of the hospitals today. And what this means is that the epidural catheter, which is inserted in your back, will be attached to a pump. And that pump will deliver a very low dose of medication continuously into the epidural, but you will also have a button. It's a small thing attached to a little cable, and that button is attached to your bedside, and you can press this button whenever you want and administer additional doses of medication. This allows you to control it exactly to the degree of pain relief that you want. Many patients find that they want more pain relief than others, some want less, and this allows it to be very flexible. Many patients have different degrees of pain tolerance, so it allows you to titrate exactly to your own degree of pain relief. Many people think that if they can deliver their own pain medications that this may be unsafe or that they can give themselves an overdose, but actually the pump is set up in such a way that you cannot overdose yourself with it.
Okay.
So once you press the button and give yourself an additional dose of medication, the pump actually turns off for a certain period of time. It's called the lockout interval. And during that time, you can't get any more medication. So even if you keep pressing the button continuously, you won't get any more medication. So there's a safety feature built in there. And the safety record with patient-controlled epidural anesthesia is tremendous. We have been using this at my hospital, Brigham and Women's, for over a decade, and we really don't have any major problems with patients overdosing themselves with it because of the built-in safety features.
That's good to know. Are there any other side effects related to epidural?
So the most common side effect is that your blood pressure will go down. This is very common, and for that reason you'll have to have an intravenous to give some intravenous fluid during the epidural, and you'll also have a blood pressure cuff, which the nurse will take your blood pressure frequently, usually every couple of minutes during the epidural. If the blood pressure goes down, usually it's not a problem and will come right back up within a few minutes. In some cases we might change your position a little bit, maybe to make you lay a little bit more on your side, which will help with the blood pressure. We might give some more intravenous fluids, or we might give a special kind of a medication in the intravenous, which will help bring the blood pressure back up. All of these are safe things. In some very rare cases, the blood pressure could go down such that you might feel a little bit lightheaded or dizzy. Again, once the blood pressure comes back up, that feeling will go away. Another side effect is that you could feel some itching. Many people think that if they get a medication and they itch from it, that they're allergic to it, but it's not an allergic reaction. Actually, one of the components of the epidural, the narcotic component, will cause some itching as a normal side effect. Very common, usually 50 to 75% of people will have this side effect, and it's not an allergic reaction, it's just a normal, common side effect. Most cases it's very mild and goes away in a little bit of time. In some cases, if it can be really bothersome, we can give a little bit of an antidote that will help fix the itching.
Okay.
Another side effect may be, in some cases, it may not make you completely numb equally on both sides. One side may be more numb than the other. That can usually be fixed by manipulation of either your position or manipulation of the catheter in the back. Another side effect is something that could happen later on after the delivery, usually a day or so afterwards, is a headache, something called a spinal headache, which can also happen after epidural anesthesia. The incidence of this is about 1%. So it does happen sometimes, but it's not very common. You'll generally be visited by an anesthesiologist in the day or so after the delivery to assess if you have any of these type of symptoms.
Okay, and what about for the baby? Are there any side effects?
So this is also a very good question because everyone's always concerned about the baby. One of the advantages of the newer modern epidurals with the newer lower doses is that much less medication circulates through your bloodstream, and that also means much less medication circulates to the baby.
Right.
So there is some that goes through the mother's bloodstream, and some medication does go to the baby, but in very, very small amounts, and also in much smaller amounts than used to be used years ago. So the actual direct effect of the medications itself are minimal. Sometimes the baby can be affected by the blood pressure problems that I mentioned earlier. If your blood pressure goes down, then the amount of blood going to the baby can go down as well. And that could be manifested by some abnormalities of the baby's heart rate. This is an unusual kind of thing, and we monitor the baby's heart rate throughout the labor so we can tell if that's a problem. If it is, then usually once the mother's blood pressure comes back up, then the baby feels better as well. So it is generally considered to be a safe procedure for the baby, but we do have appropriate monitors to check for those things.
Great, thank you very much.
Well, thank you, Amanda. Those are all good questions.
All right.
Thank you.